Today on CityLine, it's Makeover Madness. We have everything you want to know about rhinoplasty, choosing the most flattering makeup for your eye color.
Blue is a naturally cool color, so you want to accent it with a warmer color.
And a peek at far-out fashions right now on CityLine.
Well, you know this. Rhinoplasty surgery has come a long way, and Dr. Mulholland's patient, Tracey, is very happy it has. Take a look.
Okay. Tracey, come on in, have a seat.
Thank you.
So, are you excited about today?
Very excited.
Rhinoplasty to this day remains one of the most common things we do in plastic surgery. It's not something that you can fix with diet or exercise. You're usually born with it, and sometimes it's after trauma or injury, but mostly you're born with a nose that doesn't match your facial proportions.
So I'm having a reduction rhinoplasty. I'm going to have the whole end of this bone reduced, and to reduce the tip as well.
Tracey is the prototypical ideal patient for this, and she's very elegant. She's tall, she has strong angular features, and her nose slightly exceeds the beautiful facial proportions she has, so she has classic nasal facial disproportion. We can really individualize the nose to the patient, and it allows me, the surgeon, to understand what she wants, to select out a patient that might be totally unrealistic and point out things that she might not even realize about her nose. And the procedure's gotten much easier because our anesthetic techniques and the anesthesia's got much gentler. And we can usually do the procedure in about an hour and 10 minutes. It looks acceptable at a week to 10 days, 8 months, 80%, and 1 year, what you see is what you get. So the nose settles very slowly, and that's very helpful because patients are worried about a sudden change and everybody noticing.
Most people haven't noticed. They notice something's different, but they can't put their finger on what. I'm very glad I did it. Finally, I should have done it 15 years ago.
She looks amazing. Tracey looks amazing. So this is so interesting. You say that, you know, she's a wife, she's a mother, she's got kids, she works, and she was sort of waiting for the right time in her life to go and pursue this surgery. She wanted to make sure that she had some time for recovery and all that. Yeah, right?
Recovery is important. You need about a week off to look acceptable.
Yeah.
Make up some excuse like I missed that fly ball during my softball game, or I hit my nose on a cab door.
I don't think you have to lie anymore. Just say I want a new nose. And then go get one.
Well, some people are that confident that they will say that. Others need some type of subterfuge to escape the stigma that still exists around cosmetic surgery.
Right. Okay. So she came up with her excuse. She went and got it done. She looks incredible in the after. I'm wondering, when it comes to rhinoplasties, which have been really popular for some time now, is it mostly women or men? Because most people would think it's mostly women. Is that the truth?
I would say it's about 80% women, because women tend to be more confined to the beauty constructs that we have in Western culture. Yeah. And so a dominant nose on a feminine face, or a nose that isn't strong enough, or a bulbous tip, so bumps, scoops, and tips that are bulbous, will bother women typically more than men, who could, you know, look bald, fat, portly, and pugilistic and still get away with it.
Yeah, what's up with that?
You know, it's crazy. You know, we're measured more by power and money than beauty and proportion.
I want in on that action. Like, I just want to gain 200 pounds and be okay with it. Because men have got that going on. But anyways, that's a whole other show. Let's talk about the cost of a rhinoplasty. What's the range?
Well, most cosmetic rhinoplasty, remember, there's a functional component. So every time we do appearance nose surgery, we always have to balance the breathing. The breathing is covered by the healthcare system, so there's no cost associated with that. But then the nose surgery will include the anesthesia and the nurses, and, you know, so it's not always the surgeon that's getting that fee. But the range in price in Toronto would be $3,000, $3,500 to maybe $8,000, depending if it's just a bridge, just a tip, or something internal, or a combination of all three.
What was Tracey's? Was that just the tip?
Tracey was dropping the tip, adjusting the bridge, breaking the nose, and fixing the breathing. So she was a combination of all those things.
So you're actually breaking the nose, right?
Yeah, there is disrupting the bone. I don't use the word break; it sounds scary, but yeah, you have to break the bone if you're gonna set it back towards the face.
And afterwards, is her nose working as well as it was before? Is there any sensitivity lost? Does anything change?
Yeah, there is a recovery. Like all surgery, it's very important patients understand the recovery process. So you start out with packing in your nose, so there's no bleeding the first 3 days. You have a cast on, and at a week, all that is off, but you still have a swollen nose, so no one really notices it initially because it's swollen. You have your excuse, and then it changes gradually, week after week. By about 3 months, it looks pretty good. By 6 months, it looks great, and then there's a little loss of sensation that will take about a year to come back. So most people, as Tracey had a significant change, no one really even noticed.
Yeah.
They would say something like, "Oh, have you lost weight?" or "I like your hair." Comments like that.
Yeah, but that's kind of what you want, right?
Exactly.
They don't necessarily want to know, well, you changed your nose. It's just something looks different and actually looks better. So how do you decide what nose is the best nose for you? What do people do? Do they come in with pictures?
Yeah, some people come in with some pretty crazy pictures, like that Michelle Pfeiffer nose won't look good on you when you know you're 6'4". So generally, I look at the pictures, acknowledge, but then we have a lot of high-tech 3D computer imaging. And so like Tracey, I can sit down and say that nose may be what you want, but this is what matches your face, and walk through all the changes, and we can usually deliver those changes. So gone are the days where women will look at their nose at 6 months and say, well, I don't really like that, because they can see pretty much what it's going to look like before they do it. It's like a, try before you buy.
Right, and most cosmetic surgeons have this, right?
I would definitely seek out those physicians, whether you're doing breast augmentation or nose changes, where you can simulate the surgery. And so, yeah, I think you'd want to search that out if you're a patient. Absolutely, because that's crucial. You want to know what the end result is going to be like. Thank you very much, Steve. That was great. Thank you. Let's go to break. We've got more coming up. It's Makeover Madness. Interesting.